Hi, Jace here again with another physiology review. This time we are looking at the adrenal glands. Although small, the adrenal glands are responsible for various critical functions within the human body. They produce four primary hormones: aldosterone, cortisol, epinephrine, and norepinephrine. Epinephrine and norepinephrine are catecholamines produced within the medulla of the adrenal gland. The focus of this physiology review will be on the steroid hormones produced within the cortex of the adrenal gland. Each of the hormones are produced by the adrenal cortex, but does so in a specific cellular layer and includes mineralocorticoids, glucocorticoids, and sex steroids. Mineralocorticoid synthesis is mainly regulated by the renin-angiotensin-aldosterone system, sometimes referred to as RAS. However, mineralocorticoid synthesis may also be induced by potassium and the adrenocorticotropic hormone, although to a much lesser extent. Synthesis occurs within the outer zona glomerulosa within the adrenal cortex. This is initiated by the renin release from the juxtaglomerular cells within the kidney. Renin leads to the cleavage of a zymogen called angiotensinogen to its active counterpart, angiotensin 1, within the liver. Angiotensin 1 is then further cleaved into angiotensin 2 by the angiotensin converting enzyme, also called ACE. Angiotensin 2 then binds and activates the angiotensin 2 receptor type 1. This increases adrenal aldosterone production and vasoconstriction. Aldosterone is not stored in its free form. It has to be produced rapidly. Aldosterone enhances sodium retention and potassium excretion. This determines the extracellular volume. Effects of aldosterone release increases arterial perfusion pressure, which in turn regulates renin release. To put it simply, aldosterone's role in normal physiology is electrolyte and blood pressure homeostasis. Glucocorticoid synthesis is regulated by the hypothalamic pituitary axis, sometimes referred to as HPA, and occurs within the zona fasciculata of the adrenal cortex. Cortisol is the prototypic glucocorticoid and circulates in the bloodstream, mainly bound to a protein called cortisol binding globulin. Cortisol is also bound to a lesser extent to albumin, with only a minor fraction actually circulating in its free form for binding. The tissues that cortisol affects are mainly the liver, fat, and muscle. However, other targets include bone, skin, the nervous system, and the hematopoietic and lymphoid tissue. As the name implies, the obvious effect of glucocorticoids' action is the rise in plasma glucose levels. However, cortisol also has an immunosuppressive and anti-inflammatory effect. Less obvious effects of glucocorticoids are on protein and fat metabolism, behavioral effects, and the calcium bone metabolism. The adrenal androgen precursor synthesis is regulated by the HPA and occurs within the inner zona reticularis. This precursor protein is then converted within the gonads. Although only weighing in at approximately 4 grams, the role of the adrenal glands in normal physiology is critical to maintaining homeostasis. This will be evident when we dive into case discussions. And there were so many tongue twisters in that one. Sorry, you guys.